Hi, my name is Victoria. I'm a student pharmacist and I'm presenting on Rue Robinson. She is a 2-year-old African American female. She came in today complaining that she feels bad. She presented to the emergency department after a referral from the pediatric oncology physician for febrile neutropenia. Her mom said that she was warm to the touch this morning and she's been lethargic all day. She was diagnosed with acute lymphoblastic leukemia 1 month ago. She is actively receiving induction chemotherapy, and she currently has a fever of 102.9 Fahrenheit. So her past medical history just includes the acute lymphoblastic leukemia, nothing pertinent to her family history. She does live at home with her mother and father. She also has siblings, both 5 years and under. She does not have any smoke exposure. They do have a dog as well as chickens. The patient has no known drug allergies. As of right now, she is on Bactrim, 200 per 40 per 5. She takes 3.3 twice a day on Saturdays and Sundays for prophylaxis of the PCP infection. She is using chlorhexidine rinse. She swishes 3 tablespoons 3 times a day. That's prophylaxis for bacteria translocating to her port site. She is on Zofran, solution 4 mg per 5 ml. She's taken 2 mLs by mouth every 8 hours as needed for nausea. She is on dexamethasone steroid, 2 milligrams twice a day for her induction therapy. Famotidine, 10 milligrams twice a day, protection of her GI tract from that steroid therapy. She's also using a vitamin D and calcium supplement just once a day. She does have other chemotherapy agents as well. Those can be seen in the chart. She is up to date on her immunizations. For her review of systems, a skin review was abnormal with redness and irritation around her port site. And for her CNS, she just has the fever. General review of systems, her appetite and activity are abnormal. All others are within normal limits. This patient's blood pressure is 100/58. She has a heart rate of 118 beats per minute. She has 25 breaths per minute. She's 73 centimeters tall. She's 10.5 kilograms. She has a BMI of 19.3 and, of course, the temperature at 102.9. This patient's serum creatinine is low. It is 0.54, and that was using the bedside Schwartz equation. She has 11.8 hemoglobin. She has 33.8 hematocrit. Her white blood cell count is only 3,000. Her neutrophil is at 2%. She has a BANS of 1% and an ANC of 90, which are all low. We did calculate a body surface area of 0.4 for this patient. As of right now, she has pending central and peripheral urine cultures. So the patient's problem is fever in the setting of febrile neutropenia. She is ill appearing. The evidence of this is from the fever of 102.9, a decreased ANC of 90. The redness around her port site indicates an infection of skin and soft tissue. Her white blood cell count is at 3,000, and according to the NCCN guidelines for ALL treatment, the patient is at high risk and will be treated in the inpatient setting for prevention of infection and cancer. The goals for this is to eradicate the infection around the port site and reduce her fever. We are also going to want to initiate antibiotic therapy within 60 minutes according to the NCCN guidelines. For the first drug to reduce her fever, we're going to use Tylenol or acetaminophen. We're going to use the 15 mg per kg dose. With her weight, it is weight-based dosing. It'll be 157.5 milligrams. She's going to use that by mouth every 6 hours. The duration for that medication is until afebrile for at least 24 hours. We're also, for her antibiotic coverage, we're going to start vancomycin. Her dosage of 20 milligrams per kilogram, that's also weight-based, for a dose of 210 milligrams, and we're going to use the IV every 8 hours for 72 hours, or until afebrile and her ANC is recovered. We're going to do the same thing for cefepime. That is a 50 mg per kg dose and weight-based as well at 525 milligrams. That is also going to be IV, and we're also going to give that every 8 hours, and we're also going to use it for 72 hours or until afebrile and her ANC has improved and she has negative cultures. Safety and toxicity for the Tylenol, liver functions, of course. The vancomycin, we're going to want to watch her renal function, so serum creatinine and creatinine clearance level values. For that medication, we're also going to want to watch for VIR, the vancomycin-infused reactions. It's an antibiotic, so diarrhea should always be a concern. The diarrhea also goes with the cefepime for antibiotic therapy. As far as efficacy, we're going to want to see negative cultures, reduced redness, an improved ANC, and no VIR. For the Tylenol, we're going to watch her temperature, and then for cefepime, it would be the same efficacy monitoring. So that's all I have for her today. What questions do you have for me? Thank you.